Good day, everyone. I am Julian Patricia B. Sarmiento from Bachelor of Science in Nursing and Midwifery. And for today, I will be performing bed bath. Now, what is bed bath? Bed bath is done performed in a bed given to a client who isn't able to bath him or herself. Now, the purposes of the bed bath are: first is to clean the client's body from germs and any bacteria that may foster in the skin. Second is to stimulate circulation and improve general muscular tone and joint. Third is to give them comfort and help them go to sleep. And lastly is to observe skin condition or any other objective symptoms. So, in performing bed bath, we are guided by the following guidelines. First, to confirm doctor's order because sometimes the bed order may have changed, and also check the client's identification and conditions because in some instances, giving bed bath may be harmful to a client who is in pain, hemorrhaging, or weak. And second, we have to do is to greet our client and also establish rapport. We need to ask them about their personal hygiene, preferences, and their ability to assist with the procedure. Explain the procedure to the client. Assemble the equipments needed for the procedure. So, after the initial procedure, we need now to proceed to cleaning the eyes of our patient, making sure that we do not use soap as it may irritate the eyes. So we want to clean of our client from inner surface to outside surface using different side of the cloth. This is to avoid sweeping debris into the eyes of our client and also to avoid the spread of infection. Now, we can proceed to cleaning the face of our patient. So, in cleaning the face of our patient, we can use soap only if they preferred it. But remember that soap is drying to the face. We may also follow the number 3 pattern to forehead, going to the nose, and from the nose, going to the chin. We may also want to include the ears of our patient. So, after cleaning the face of our patient, we may now proceed to the upper limb. So, in cleaning the upper limb, we can now use soap. We also need to do long stroke as long stroke stimulates circulation by facilitating venous return including the upper limb. We also want to start from the distal to the proximal. Now, I want to remind all of you that while I was performing bed bath on my client, the bed was already close the wall. Hence, I cannot go to the other side of the bed to do the other side. But you need to be reminded that the same procedure will be performed to the other arm of the client, the same thing that you did to the first one. Now that we are done with the upper limb, we can now proceed to cleaning the chest and the abdomen of our client. So one thing to remember here is of course put the back towel under the trunk of our client. so that we may avoid wetting the bed, and also put the back towel over his or her chest so that we may be able to provide privacy that our patients needs. And so after performing this procedure, we can also change the water that we are using from bed bathing. It is because it might have cooled down already, and the second one is because it might have been cleaned. So before proceeding to the next step, which is cleaning lower limb, we can first change the water that we are using. Now that we're done cleaning the chest and the abdomen of our patient, and we already changed the water that we are using, we can now proceed to the lower limb. So in cleaning the lower limb, we have to bend the knees of our patient. This will allow us to have a easier access to the top leg and also to the bottom part of the leg. Also, if necessary, we have to provide a pillow or cushion underneath the knee so that may be able to provide support. In cleaning the legs of our patient, you also want to start from distal to proximal. So from the foot of our patient to the knee, and from the knee to the upper leg of our patient. So again, I would like to remind everyone that while I was performing this method, the bed was already close to the wall. Hence, I cannot go around the bed in order to clean the other leg of my patient. But what we have to do here is what we did in the first leg. We just have to clean it like the other leg. Okay, after cleaning the lower limbs of our patient, we may now proceed cleaning their back and their buttocks. So the first thing that we have to do here is to turn them on a lateral position. This allows us to have a easier access and visualization of their back. So if the client isn't able to assist us in doing this procedure, the first thing that we have to do is to bend their knees and then turn them into a lateral position, making sure that we need to be gentle in every move to our patient. The next thing that we have to do is to observe for any skin indications, as skin breakdowns is commonly occurs over bony area, so we also have to be careful in cleaning the sacral area of our patient. And also, if ever there's a need of a client, we may also perform back rubbing. Wash the perineal area. If patient is able, place a towel under the buttocks and bring basin and soap within client's reach. Instruct client to complete the bath herself. Have the client wear a new gown and comb the hair. Apply lotion and powder if desired by the client. Discard soiled linens and remove equipment used and store them in proper place. And so after performing all the steps in bed bathing, we have to make sure that the patient is comfortable before taking them. After this, we need our document procedure. So, that is the proper procedure of doing a bed bath. Overall, bathing is an important part of personal hygiene. Bathing cleanses the skin, makes the patient more comfortable. It stimulates the circulation and relaxes the patient. And also, it's a good opportunity to serve and observe the client's body and as well as to communicate with the patient.